What is selective mutism? It is a child and teen anxiety disorder in which the child cannot talk in certain places. This could be, and this is usually the pattern that we see, that the child speaks at home with his close family, but cannot speak outside the home. And that could be in school. Sometimes it's with grandma and grandpa. It could be total, that the child can't talk to peers, classmates, and to teachers. And it could be that they talk to some children and not others, and not to teachers. So each child or teen with selective mutism has their own constellation, their own pattern of where and with whom they talk and where and with whom they don't talk. It not nearly always sits on an anxiety disorder. That is social anxiety, that they don't feel comfortable, they don't feel confident enough to talk in certain places to certain people. Sometimes it can also go into adulthood, and that is usually when it's not treated. When it is treated, then it is usually amenable to treatment. It usually can be treated successfully, as we've seen in our Chinese clients, where nearly all of them are treated so successfully after only 10 sessions guidance, and that's incredible. So it is an anxiety disorder nearly always. It also very often, in approximately 70% of the cases, has a language component, because it is behavioral inhibition in which the child doesn't speak. But it also has, it expresses itself in the lack of speech. And so it stands to reason that very often there is a language component, that an anxious child without any language difficulty might not develop selective mutism. But when there is also a language component, that could be bilingualism, it could be a slight language delay, it could be a pronunciation issue, it could even be a mild one, then it can be enough of a constellation to bring about selective mutism. So we've got this anxiety disorder, often together with a language difficulty, sometimes quite severe, sometimes not. And that causes selective mutism. It usually starts very, very early. Usually parents can't quite put their finger on it when exactly it started, because it could have started early on and not been noticed. The child would have been thought to be shy. And early on, at the age of 2 or 3, it's quite usual that children don't communicate verbally. So if they're giving these gestures, it may not be noticed that it's selective mutism. It is important to note that there are extreme differences between children with severe selective mutism and with quite light selective mutism. Some children will go to kindergarten or school and be social and be very seemingly happy and functioning without opening their mouth. And some children will be so inhibited, so frozen by their anxiety that they won't move. They'll appear to have a mask over their face, no expression, no smiling, no laughing, no crying. So some children won't eat, some children won't go to the bathroom. So within selective mutism, there are different levels of, let's say, seriousness. And it's hard to put any one child in a specific category, because some children will absolutely not speak to any adult, but they will speak to one child. Some children, but they appear to be quite happy. And some children will not speak to anybody and also appear to be quite happy, while others might be speaking to quite a few and seem very, very troubled. So it's hard to categorize each individual child into, a level of severity. Important to note that it is a phobia. So the child cannot talk. It is not that he has decided to. It is not that he has elected to not talk to certain people. That he cannot talk, and he needs a step-by-step approach in order to enable him to talk. So on the one hand, selective mutism is a severe disability. It is really troubling not to be able to speak and communicate freely. On the other hand, usually it is quite amenable to treatment.